Hi everyone, welcome to lecture 19 where we're going to talk about Fragile X and Williams syndrome. Both are commonly associated with intellectual disability, and most of the disorders we're going to talk about this week are going to deal with intellectual disability being commonly associated with them. And that's why we're talking about them in this course. Although this happens to varying degrees, most of them, again, just like anything, the amount of or the impact of intellectual disability occurs on a spectrum. So some may have more severe types of intellectual disability and some may not within the disorder, and I'll point that out to you. Just make sure that you guys get a good look at the websites that are assigned for both of these things. Those are the primary sources for where you're going to get information in addition to this lecture. But when you're in discussion posts, make sure you're referencing the websites themselves. Anything that I would want you to know for an exam, for example, though, is going to be within the lecture. So I don't want you to feel like you have to know everything on all these websites because that could be quite daunting. So anything that I would ask on an exam or want to highlight on an exam or a quiz is going to be contained within these lectures. But for your discussion posts, definitely make sure that you take really good looks at each of the websites that are assigned, in addition to the articles that are assigned as well, and you can use those as references for your discussion posts. So with Fragile X syndrome, again, it's the leading cause of inherited intellectual disability, which again means that it's passed down from parents or somewhere along your genetic line. It is a genetic condition, though, involving changes in part of the X chromosome, and because of this, it occurs more often in males than females. And because females have two X chromosomes and or sex chromosomes, and males have an X and a Y, since males don't have an additional X to possibly overpower the Fragile X, that's why it occurs more often in males than females. Individuals with Fragile X have delays in cognition, again, to varying levels, which we'll talk about depending on certain things, social functioning, and emotional functioning. So now I'm going to show you guys a video about Fragile X. Here.
According to the CDC, the prevalence of Fragile X syndrome in males is approximately 1 in 4,000 and 1 in 6,000 in females. To learn more, we went to CHOC Children's Hospital in Orange County, California, and spoke to Dr. Nita Zadeh, who is board certified in clinical genetics, clinical molecular genetics, and in pediatrics.
Fragile X is the most common cause of hereditary intellectual disability. It's caused by disruption in the Fragile X gene, which is also known as FMR1. Fragile X syndrome is caused by an expansion of DNA, which is also known as a repeat, in the beginning part of the Fragile X gene. All of us have this expansion or repeats of DNA. They're also known as CGG repeats. So in people that are unaffected, they can have between 4 to 45 repeats. In patients that are premutation carriers, they can have between 55 to 199 repeats. In patients with full Fragile X syndrome, they have 200 or more CGG repeats. And it's important to know this because depending on the number of repeats, we see different features. Some of the common features that we see is definitely developmental delay. So not walking on time when we would normally expect a child to, and not talking on time. A lot of the physical features that we see in children with Fragile X may not be as obvious until people get a little bit older, maybe mid-childhood to early adolescence. Some of the physical features that we can see tend to be slight differences of the face, maybe a longer or more narrow face, maybe larger sized ears. Sometimes individuals can have joint flexibility that's more pronounced. Some children can have seizures. The other big aspect of this is behavioral issues. So many individuals with Fragile X syndrome have intellectual impairment and also some autistic-like features. And by that, I mean that maybe some social shyness, poor eye contact, difficulty with sensory processing. While there's no cure for Fragile X syndrome, there definitely is supportive therapy that we find an earlier diagnosis is always a good thing because it allows us to make certain that children are getting good speech therapy, occupational therapy, any sort of supportive measures that really helps try to move them along developmentally and help them reach their best potential. This is a condition that affects the entire family. Once we have a child that's diagnosed with it, it opens up possibilities for everyone else in the family. We may find that grandparents and siblings are also carriers. We may find that an aunt has premature ovarian failure. We may find that cousins are pregnant and having affected children. So it becomes a complex discussion, but it also becomes something that we aim to not only take care of the child, but also to take care of their family.
The doctor discusses the diagnosis of Fragile X syndrome.
We can take blood, a very small amount of blood, saliva, or skin from the inside of someone's cheek, extract the DNA from it, and look directly at the FMR1 gene and look to see the number of CGG repeats that that person has. It's very accurate, and we can tell someone if they're a carrier or if they have full Fragile X syndrome. This is a condition that affects both men and women. It occurs in all ethnicities, and because of this, it's a very important topic all over the world, where we see a lot of support groups that have popped up and a lot of research that's taking place on almost every continent. The research that is being performed now is various on multiple levels. The ultimate goal is to improve quality of life and maybe one day have a way on a cellular level of fixing the genetic problem, because currently we're not able to do that. And to also have a better understanding than what we do right now as to what the protein actually does in the brain and how we can be more helpful to our patients, as well as carriers who have other features.
So that video just highlighted again some of the real key pieces for understanding Fragile X and how it's diagnosed, and really talked about the FMR1 protein, which we'll talk about, and also the number of the CGG repeats, and that kind of determines whether or not, I guess, how manifested the disorder is, and we'll talk a little bit more about that. So we know with Fragile X, at birth, like it mentioned, there are no obvious signs. It's usually not until later on, specifically the attainment of developmental milestones like walking, talking, sitting unassisted, when things are first noticed. If someone doesn't realize that they're a carrier and it, it hasn't affected their family. Usually if somebody in the family already has the disorder, that kind of alerts folks to know that they may be a carrier for the disorder. And the video talked about how testing for that is really good and is definitive and can let you know if you're a carrier for Fragile X. Physical features that were mentioned, elongated face, larger ears, a more prominent jaw, macrocephaly, which is a larger head, flat feet, and a high arched palate, and also extensible joints, so being hyper flexible in your joints. So again, some of this here also again points us out to just some things. Again, these aren't necessarily diagnostic in nature, but rather are commonly associated and can really again help clue us into possibly some secondary health conditions and stuff to kind of keep an eye on. So when we're looking at what causes Fragile X, we know it's changes in the Fragile X mental retardation gene 1, or the FMR1 gene. Again, that was named, that gene was named before the change in term from intellectual disability, from mental retardation to intellectual disability, and that's why it's called that, but it's just referred to the FMR1 gene. That this gene usually makes a protein called Fragile X mental retardation protein, and this is needed for normal brain development. And we know that people with Fragile X don't make this protein. So to explain that a little bit further, I'm going to show you guys another video. The genetic stuff can always be, it's very interesting, but I feel like it's best explained through visuals, which this video does a nice job doing.
Fragile X syndrome is the world's most common inherited cause of mental impairment and the most widespread single gene cause of autism. Fragile X syndrome occurs in about 1 in 4,000 in males and 1 in 6,000 to 8,000 in females. Fragile X syndrome is associated with a change or mutation in a gene on the X chromosome. Humans have 23 chromosomes, and the X and Y chromosomes are the ones that determine your gender. Females have 2 X chromosomes, and males have 1 X and 1 Y. Girls receive 1 X chromosome from their mother and 1 from their father. Boys receive 1 X chromosome from their mother and a Y chromosome from their father. Chromosomes are located in your cells, and every cell in your body has the same chromosomes. Chromosomes are strands of DNA that contain many genes. A gene consists of a long combination of 4 different letters, A, C, G, or T. Different combinations of the letters A, C, G, T give people different characteristics. There's a gene on the X chromosome called the FMR gene that is responsible for producing a protein that is vital for normal brain development. It is normal for this gene to have a section of up to 44 repeats of the letters CGG. In some people, however, this gene may contain between 55 and 200 repeats. This is known as a Fragile X premutation. A person with this premutation is called a carrier. Fragile X syndrome occurs when this gene contains over 200 CGG repeats. The long segment of CGG letters turns off, silences, the FMR1 gene, which prevents the gene from producing proteins, which in turn disrupts brain development. The Fragile X mutation can be passed down through each generation. Daughters born to male carriers will inherit their father's affected X chromosome. They will also be carriers. Sons born to male carriers will not inherit their father's X chromosome and will therefore not be affected by Fragile X. Because females have 2 X chromosomes, children born to female carriers have a 50% chance of inheriting the affected gene. Those who inherit this gene will either be a carrier or have Fragile X syndrome, depending on whether or not the premutation expands into a full mutation. Premutations are unstable when they are passed from mother to child. Fragile X results in learning disabilities, cognitive impairment, autistic behaviors, hyperactivity, and unique physical characteristics. Infants with Fragile X syndrome may display poor muscle tone, gastric reflux, frequent ear infections. Their motor and mental milestones, as well as their speech, tend to be delayed. Males with Fragile X syndrome often have unique physical features, such as a long, narrow face, a prominent jaw and forehead, a large head, flexible joints, flat feet, large ears. These symptoms
So for that there, again, it just really highlights the importance of understanding how the genetic model, because again, it is the leading cause of genetic types of intellectual disability. It allows us a model so researchers can understand intellectual disability greater as a whole. Additionally, we're going to talk about in a minute a little bit about its association with autism. It's highly comorbid with autism, but some of the features in it when an individual has Fragile X and autism, they just look a little bit different. And there's some key distinctions when looking at core diagnostic features that we'll talk about. So when we're looking at the cognitive profile, so the majority of males with Fragile X syndrome exhibit moderate to severe intellectual disabilities, and in general have stronger verbal rather than visual spatial abilities, so more nonverbal abilities. So visual spatial is understanding, again, just more like abstract thinking, those types of things. So they have stronger verbal abilities, which is great. The cognitive outcomes, so depending on how severe the cognitive impairment is, are mediated by the level of the expression of that FMRP protein. So males with higher FMRP levels or a full mutation that is not fully unmyelinated can be higher functioning, because again, we know that that protein is really important for cognitive development. If they have more of that level or it's not a full mutation, that's not fully, again, unmyelinated, it can lead to higher functioning. Individuals that have a full mutation, we're talking an IQ score in the 40s, so pretty low. Females with Fragile X can range from mild intellectual disability to actually normal range of functioning. Both sexes, so males and females, do present with deficits in social functioning, and we do know that IQ does tend to decline more over time than the general population, and this is particularly true with males. So when we're talking about, again, both of the videos highlighted that Fragile X is comorbid with autism spectrum disorder. And we know that about 15 to 25% of individuals with Fragile X also meet criteria for autism. The reason for the overlap is unknown, but it may have to do with the FMRP levels. We know that the low FMRP levels leads to hyperarousal of the autonomic nervous system, which results in increased avoidance and also social anxiety that we see with individuals that are on the spectrum. We know individuals with a dual diagnosis experience impairments across multiple domains and greater than expected deficits in receptive language, which is understanding language, so what folks are saying to one another, and also theory of mind pieces. The core deficit in autism, remember though, is social interaction. However, the core deficit in Fragile X is intellectual disability and hyperarousal. And so that can really help us determine whether someone has Fragile X and an autism spectrum disorder or just Fragile X, because some of the core diagnostic features of Fragile X also can look like autism. But in order to meet a diagnosis for both, we would want to see also a real core deficit also in social interaction, not just some difficulties that are commonly associated with Fragile X. And this can make it a little bit different, a little more difficult to diagnose, because we know autism is a behaviorally bound diagnosis, which means we diagnose it by looking at certain behaviors. There's not a blood test or a genetic test currently for autism. But Fragile X syndrome is a medical, or more accurately, a genetic diagnosis. So when associated with Fragile X, the autism is caused by this genetic change or mutation in the Fragile X gene. This is similar to other conditions such as Down syndrome. So we know individuals with Down syndrome can also have other conditions, including autism, hearing loss, diabetes, and other behavioral and medical conditions. But if a child is diagnosed with autism and then diagnosed with Fragile X, he or she does still have autism. It's just that the cause of their autism is known. It's no different than someone with Fragile X also having ADHD or another behavioral symptom of Fragile X. So again, but really pointing out, again, these core deficit piece. I think it's really important to look at this because we know, and we'll talk about this, people with Fragile X in general intend to really desire or really enjoy human interaction. But the social anxiety that also typifies the condition may lead them to act otherwise, which can prevent success with social interactions. And we know that people with autism are largely unaware of the function of others, of the function of other people, and kind of how people relate to them and how they relate to other people. And that's that theory of mind piece. So then they rarely seek social interaction. So again, it's really important to not lump these two things together. It's possible, again, there's a lot of symptoms that are commonly associated with Fragile X that are commonly associated with autism. But in order to have a diagnosis of both, we want to make sure that we understand the core diagnostic features. And then that's when, again, really looking at that social interaction piece. So some other related concerns when we're talking about Fragile X. So it's also more highly comorbid with anxiety, depression, and attention deficit hyperactivity disorders. When we're looking at behavioral problems, again, we're looking at, when we're looking at these behavioral problems, again, these are not occurring as part of the Fragile X. These are things that are occurring in addition. We also know that there are speech and language difficulties with this population, specifically rapid speech rates, perseveration on certain topics, so wanting to talk about one thing over and over again. Additionally, having tangential speech, echolalia, so that's that parroting that you'll sometimes also see in autism spectrum disorder. More deficits in nonverbal communication, which can involve the use of facial features and or just facial gestures and using your hands to communicate. We know that males with Fragile X usually have a really distinct or specific speech pattern, and we know that expressive language is more impaired than receptive language. So when we're looking at interventions, like they mentioned, there's no cure for Fragile X. There's been very few studies regarding the efficacy of interventions for Fragile X. Again, thinking about why this is, again, just talking about how it is, while it's the most common and inherited form of intellectual disability, it's still a very rare disorder. We do know that there are some behavioral interventions using positive behavior supports and applied behavioral analysis principles that we've previously talked about that can be beneficial. Also, seizure medications can be helpful. Also, medications commonly used for ADHD, anxiety, and depression, including SSRIs, are also have been effective if individuals also have those things. Speech language therapy that focuses on articulation, so how people speak. Pragmatics, which is understanding that social language piece. Teaching them scripts, so actual, like, this is what you say when someone says, hello to you, and so on and so forth. The use of augmentative and alternative communication devices, possibly through the use of like PECS or a picture exchange communication system or a talking device. Also, occupational therapy. This can also help with decreasing sensory sensitivity, so different sensory experiences like touch, sound, light, and also helping with fine motor skills there. All right, so that's Fragile X. And again, if you have any questions at all about that, please let me know. Again, I think the real important thing for you guys to know, it is the leading cause of inherited intellectual disability. Also understands at least a couple of the core diagnostic features that were mentioned a couple times. So, and then also understanding, making sure that you understand what the role of the FMRP protein plays. And whether and how severe or not severe the diagnosis is. And now we're going to get into Williams syndrome, and this incident is this is even more rare disorder. It occurs in approximately 1 in 20,000 births. It's caused by a microdeletion of chromosome number 7, and the gene missing impacts elastin or connective tissue. And so now you guys are going to watch a video that kind of explains Williams syndrome. I've had the pleasure to actually work with a decent number of children and adults with Williams syndrome, and they're really well, everyone of course that we're talking about is very unique within their own disorder, but Williams syndrome individuals have some really unique strengths that can be really interesting to learn about.
Extraordinary gifts, unique challenges, and more than just a few of each. These are the hallmarks of individuals with Williams syndrome. Williams syndrome is a rare genetic disorder which affects approximately 20,000 people in the United States. It is caused by the deletion of 26 plus genes on one copy of an individual's chromosome number 7. Williams syndrome and families of affected individuals encounter major struggles. Individuals born with Williams syndrome share many common facial features, as well as a constellation of medical, neurological, and behavioral characteristics. Most individuals with Williams syndrome have mild to severe cardiovascular disorders, often requiring surgery, and many suffer from kidney, bladder, and gastrointestinal difficulties as well. Children with Williams syndrome can experience hypersensitive hearing, feeding problems as infants, developmental delays, poor motor skills, and mild to severe learning disabilities. As they grow, they struggle with things like spatial relations, numbers, and abstract reasoning, which can make daily tasks a challenge. Many adults with Williams syndrome benefit from supportive housing to live to their fullest potential and work primarily in part-time and volunteer positions. Added to that are the extraordinary gifts of Williams syndrome. Unlike many disorders that can make connecting with your child difficult, individuals with Williams syndrome tend to be social, friendly, and endearing. Parents often say the joy and perspective a child with Williams syndrome brings into their lives had been unimaginable, and their special personalities and perseverance help make dreams come true. Individuals with Williams syndrome also have a very special relationship with music. For most, there is a passion for music that in itself can help enrich their lives. For some, the passion blooms into a musicality that far exceeds their abilities in other areas. Adults with Williams syndrome contribute to their communities as both paid employees and volunteers, working in restaurants, at senior centers, and assisted living facilities, in libraries, or as store greeters or veterinary aides. No matter what they are doing, they seem to make a special impact and have a unique ability to quite naturally brighten the days of those around them. Please share this video to help us spread the word about Williams syndrome. Visit us at www.williams-syndrome.org to learn more.
So, like I mentioned before the video started, and like they eloquently, sorry about that, pointed out, individuals with Williams syndrome, again, I've had the pleasure to work with a decent number of individuals, children and adults over the years. And they're very social and very, very friendly, which makes them just so fun to be around. But also thinking about that, unfortunately, the capacities that I've usually had to work specifically with adults with Williams syndrome are because of this social piece. You guys can stop and think for a second and think, what does that put them at risk for? And that is being taken advantage of in many different situations. And so my work with adults with Williams syndrome usually has had to deal, pretty much every time has dealt with them being victimized in some way and kind of helping them through legal or court proceedings, or helping individuals kind of understand their limitations as a function of having intellectual disability. Most individuals that I've worked with Williams syndrome adults, they have mild intellectual disability, so they're higher functioning individuals, and so they're able, to go to take some college classes, go to community colleges, but again, being in those types of situations and being more independent and not having enough supports educationally in place does, the folks that I've worked with have led them, unfortunately, to be victimized in certain ways. Again, look around the Williams syndrome website to get some more information. I'm going to point out a couple of pieces here just to draw your attention to. Like the video pointed out, there's a wide range of IQ, but most do have mild intellectual disability or moderate intellectual functioning. We know that there are developmental delays in speech, language, motor, and academic skills. Again, as far as like reading, again, most individuals with Williams syndrome are able to learn to read, and they do have with a strength in phonics-based spelling, so spelling words exactly as they sound. We know that there are limitations in visual spatial development with poor visual motor skills, which do lead to some difficulties with handwriting, and also difficulties with mathematical or numerical knowledge. The video also highlighted the stellar musical abilities, which again I've seen across children and adults that I've worked with Williams syndrome, and it's pretty amazing for it's this like affinity that they have for music and understanding music, and also really enjoying it. Just some health concerns that are, again, this is important to have a good understanding, again, when we're support planning for an individual, especially as they get older with Williams syndrome. So the first one is heart and blood vessel problems. Typically, there's a narrowing in their pulmonary arteries, and again, this also leads, because there's also an increased risk for development of blood vessel narrowing or high blood pressure. Over time, it's really important that their cardiac status is monitored very, very closely because of the risk of heart problems. Also hypercalcemia, so having more calcium in their blood. We also know low birth weight or slower weight gain. A lot of times they'll tend to be slower stature, so it's really important that that's monitored over time. Feeding difficulties. and then dental abnormalities. The dental abnormalities usually are slightly small, widely spaced teeth are common in children with Williams syndrome. They also can have a variety of abnormalities in the bite, tooth shape, or appearance of their teeth, but most of these dental changes can be helped with surgeries or any type of orthodontic correction. So that's really good. So this is just important, again, to keep an eye, to have a good understanding of, so that way we can appropriately, again, support plan for it so there aren't additional secondary health conditions that arise. And then the socio-emotional characteristics with the video also really highlighted there. So we know, like I mentioned, they do tend to be overly friendly or excessively social in their interactions, which is, again, amazing strength that should be used when support planning, but again, can also lead to higher rates of victimization. Individuals with Williams syndrome also tend to be more anxious than other individuals, which again is important to make sure, again, that you support plan for it, so that way they can be successful and that doesn't become a barrier. We know that they have a really well usually developed vocabulary, but have difficult with reciprocal conversation. And when we're talking about that, we're talking about that to and fro in conversation. So I say something, you know, when you're usually having a conversation, for the most part, someone else then says something, builds upon what you say and says something back and is able to stay on topic, or not only talk about something that they want to talk about, and that's that reciprocity. And additionally, also difficulties with sustaining attention in conversations or activities in general. So those are just a couple things, you know, again, that wanted to point out about Williams syndrome. In the last lecture, we'll talk a little bit more about a couple of other different syndromes. And again, make sure you take a look at the websites for Fragile X and Williams syndrome. But again, anything that I would want you to know for a quiz, again, will be contained within this lecture. But definitely use those websites as resources in your discussion posts. Thanks for your attention, and if any questions about any of the material or need clarification, as always, reach out, let me know. Happy to help. All right, have a great day.